talk about the GLPs and the dietitian's role in supporting the gut. So for just a quick introduction, for those of you who do not know, my name is Sherry Stoka. I'm here with Erica Gutierrez, and we are functional nutritionists. We are with Weight Loss MD. I own Weight Loss MD. We've been in business for about 10 years now. So we have feel very fortunate to be able to work with so many people over the years and really utilize not only medical weight loss, but really that whole foundational holistic approach. So just a couple things about us. We believe that healthy food and balance in the body is foundational to weight loss. We take a look at the whole body, so we're always looking at root issues and better understanding imbalances in the body. We've spent years creating our programs, and we've done multiple studies to better understand, what strategies work, what strategies don't work, and then obviously the ones that really kind of blow our minds, we utilize. And still to this day, we've incorporated many different programs that continue to be successful for us. So Weight Loss MD is a team of RDs, functional nutritionists, health coaches, nurse practitioners, and I do have a collaborating medical director, which that allows us to incorporate, the medical aspect, the medical weight loss. So we are creating a platform called Weight Loss RDs, and really the whole approach with this is really trying to collaborate with dietitians everywhere. We are the experts when it comes to weight loss. We are the experts when it comes to nutrition. And we feel that we've really built a foundation in this weight loss arena, and we just really want to collaborate and help others, do the same. So that's why we're here, and we're excited to talk about this topic because it has kind of taken the market by storm. So today we're going to talk about a few things. And the first thing is we're going to go through the gut and really talking about the importance of gut health. We'll talk about pros and limitations of gut testing. Erica's going to review what an obese gut looks like, what a lean gut looks like, and then I will talk a little bit more about GLPs and really what it's doing in the gut. We'll talk briefly about supplements, food, and we'll wrap up with questions and then really talking about a really exciting GLP training course that we put together and will be launching soon as well. So Erica,
right.
I will let you take it from here.
Sounds good. So feel free if you guys have questions along the way to just put them in the chat box. We will be checking them and answering things as we go. We want this to be a discussion as well. So feel free to do that. So this might take you back to traditional training. We learn where things are digested. We learn that the pancreas produces enzymes. We learn that the liver produces the bile. All these things need to be working in combination in order for us to digest and absorb our foods. So the thing I don't think they talk about enough in our training is, when we have dysfunction and what is causing some of this dysfunction. So if you've heard us talk at all in the past, the food quality and lifestyle, those things impact our gut health in such a significant way. The SAD American or the standard American diet, the SAD diet, lifestyle factors. There are so many studies out there showing how stress, lack of movement, those sort of things really can change the gut microbiome and change motility and change the acidity of the stomach. So all of those pieces have to be working in combination. So when we have poor food quality, processed foods, when we have a poor lifestyle, this leads to gut permeability, which causes imbalances in the way we absorb things. And there's a mismatch with signaling to these other organs that support digestion as well. So the first part is all this dysfunction. And what comes with that is, for some people, it's too much bacteria. For some people, it's too little bacteria. Sometimes it's infections because we have the wrong acidity in the stomach and things are able to get through the stomach that aren't supposed to. It could be parasites. And I see poor motility for a lot of people, and this could be too fast of a transit time or too slow of a transit time. All of those things can be devastating to digestion, but also the type of bacteria you have in your gut. So I wanted to start with the pros and limitations of stool testing. When we did this recording last time, I was shocked because most people have not used or utilized stool testing in their practices. And we've been using it 8 years, I believe. And I have experience with the GI map. That's probably I've had the most experience with, but also GI effects, the gut zoomer, and microbiome FX. And I will tell you, there is no perfect test out there. I wish we could pull together all of these tests and pick our favorite things from them. So each of them have missing pieces. So don't get me wrong, these stool tests are amazing. They give us a really unique glimpse into each person's microbiome. I always equate it to like how our fingerprint is unique. Our gut really is unique as well. And it can give us a very customized approach to helping people get healthier. It looks at the root of all issues, of all disease, right? Some of the other limitations, though, is it's really complex when we get down to the bacteria level. And while there has been a ton of testing done, it's still not fully understood. We don't know exactly how each of these bacteria work with each other. We can't isolate just one and say this is the root correlation to something. So I think that's what we see a lot in practice is other providers are maybe honing in a little too specific on one strain of bacteria and not taking that bigger, broad look back at that whole picture, but then also the why of what we're seeing on these tests. The other thing to keep in mind is the gut terrain is always changing. We're eating something different at every single meal. We have all these different inputs of stress and sleep and toxins in the environment. So by having a stool test that is just, one stool, or for some tests, it's 3 separate stools, we still don't know what your stool looks like the next day. So it's still just like blood work. It's a snapshot in time. So I am going to get into this obese microbiome. And I just want everybody to be on the same page with this too. Excessive weight is really just a symptom of dysfunction in the body. It's a symptom like anything else we look at. And what we have found is it has a lot to do with the bacteria that are in our guts, because these bacteria are breaking down the foods and they're actually producing a bunch of things, hormones, neurotransmitters, certain vitamins. And it affects how our glucose is metabolized. It affects the type of energy that actually gets into our body. And then there are a lot of bacteria that actually produce inflammation in the gut as well. So if you look at this right-hand side, these are a couple little snapshots from the GI map. And you can see that a couple of these levels are high. Citrobacter, often related to pain or rheumatoid arthritis. Klebsiella, often related, or it does produce histamine in the body. So for someone that has high histamines, it's something to look at. But again, I'm stressing, we don't go after this one bacteria. We look at the picture as a whole. We assess symptoms and make suggestions based off of that. There's been a lot of research done on the phyla levels, the ratio of firmicutes to Bacteroides. And we have done hundreds of these tests on overweight and obese patients, and we honestly have not seen a correlation. So what's supposed to happen is an obese person tends to have a higher ratio. So it's up in that red area. But a lot of our patients, actually most of our patients are in that green area. So I think more research needs to be done on that. Or potentially it's the type of bacteria that GI Map's actually testing and it's not exactly correlating. Another one that's important to look at and that's tested is Candida. We find a lot of patients have significant GI issues with it, but more importantly, related to weight is the cravings and hunger cues. Candida is notorious for those things. So anytime we see this show up, we have a protocol where we help them reduce that level. Some of the other things, so you can see now on the left-hand side, this one's from GI Effects, and these are pieces I really like to look at because more than just these specific strains of bacteria, it's about the diversity, it's about the variety, it's about the patterns that are shown in a healthy population that really make a difference. But then also the short chain fatty acids. And I know Sherry's going to talk more about these specifically, but our short chain fatty acid profile is extremely important for overall health and specifically for weight management. And the GI Effects is great because it will actually show you the total short chain fatty acids, but then specifically butyrate, which has been highly studied as well. Now we're going to talk a little bit about the lean gut. So I want to start out with this study that was done. It was actually on an obese gut, and it was in an animal study. So it was a mouse. But what they did is with an obese gut in these mice, they fed them all different types of diets, a higher carb diet, a higher fat diet, and a well-balanced healthy diet. All three of those obese mice categories gained weight. So once we get to the place of an obese gut, we can no longer just incorporate diet and exercise in order to reduce weight. So some of the things you want to look at and some of the things that really support lean gut, number one, diversified diet. The more variety we can get in the diet, the more variety of bacteria we have in the gut. Now, we often, as dietitians, get patients that come in with these gut issues that are on a very restricted diet because they no longer can eat certain foods because it causes the digestive issues. So it really is a process. And that's why the stool testing is so helpful because we're able to see how to rebalance it and get that diversified diet back. Prebiotics are a huge piece, polyphenols, different things like that are feeding the good bacteria will also help those bacteria thrive. Now, I don't want anybody to rule out or forget these lifestyle factors and how important they are. Childhood trauma is a huge one that affects the vagus nerve and overall gut motility. Sleep and stress are also huge contributors to gut issues. Movement. There are a lot of studies, if you look out there, that regular exercise, regular movement will change the gut microbiome in a positive way. And then all the environmental factors, all of the toxins and things that we're coming into our microbiome can really change things as well. So do we need gut healing supplements? Most people need something. And just like, I say a multivitamin is like a seatbelt, a probiotic can really be that seatbelt as well. But you have to understand the gut because you can actually be giving probiotics that are not helpful to people. So there really is a science to all of that. Listed here, you'll see a couple of the supportive strains. This is by no means, we need to look at every single one and make sure a person has all of these. I will tell you, we have one of the strains is the Akkermansia, and we have obese patients that have very high levels of Akkermansia. Some have very low, of course, but by just looking at Akkermansia alone, I think you're missing a big picture of how the microbiome affects overall weight.
Yeah, and Eric, I just wanted to also mention, I'm not sure if you mentioned it just before, but about antibiotics, you know,
Mm,
really assessing a patient's history, even if they were a sick child, a sick baby, that could affect their microbiome for the rest of their life, along with how they were delivered. You know, C-section babies have a very, very different microbiome than natural delivery. So I think, again, it's super important to not just ask somebody, you know, oh, you know, how is your gut health? And they're like, it's been great. But, you know, lo and behold, you know, 10, 15 years ago, they were on IV antibiotics or something along those lines. So it is really important to just dig a little bit deeper, because that could be really putting, you know, a big part of putting the pieces together.
that's a really good point. And we do ask some of those things on our intake form so that we can look at that whole picture. What we often see for people that have been on antibiotics, their good or commensal bacteria are really low. So they're not producing those short chain fatty acids. So they're already at a disadvantage for sure.
Yeah, and just going back to like the testing, and again, we understand that not everybody is gonna, you know, jump on the stool testing and things like that, but just little things to keep in mind that most people will assume that if they are having gut issues, that, oh, they probably have something bad in there and they need to go into a kill mode. Okay, they want antimicrobials, they want different herbs that are going to kill. And usually what we see is on the GI, what we'll find from results perspective is that that would be the last thing that we need to be doing. We actually need to be replenishing and nourishing and building all of the different microorganisms that have been literally become extinct for a period of time. So it really is just kind of, you know, just kind of knowing like different things that you could be thinking about when, you know, when talking to someone about their gut health. Okay, so this is where I will take over. I'm going to talk about the GLPs now, and the gut and how this all comes together, because, you know, we are constantly talking about the gut with our patients, and then now, lo and behold, here we are. The weight loss industry has been, you know, has been taken over by these GLPs, and we really are so into digging and understanding what the heck is going on. So GLPs, glucagon-like peptides, you know, they have many different mechanisms in the body. It's not just about the weight loss and the effect it has on the pancreas and gut motility and things like that. GLPs are designed to affect numerous systems in the body. And again, I know these slides are kind of busy. We always intended on having this like open discussion, but we end up kind of talking more. So I don't, you know, I hope the slide's not too overwhelming. But if you just look at, you know, this simple image here, you can see GLPs, you know, there's GLP receptors in the brain. So it's going to help with, it's going to signal to the brain for satiety and appetite control. Obviously, the pancreas is a big part of the GLPs and its mechanism. It helps with clearing fat from the liver. It helps detoxify the liver. So when you look at the health of people today, they are dealing with all of these issues. You know, they can't control their hunger, they're insulin resistant. We have fatty liver disease now that's increasing by leaps and bounds even in children. So it's like, what's going on with the GLPs, that are really supposed to be doing all of these beneficial things in our body? And GLPs are peptides, okay? So peptides are chains of amino acids. They are signaling molecules. They are considered regenerative medicine. And we have over 100 different FDA-approved peptides that we use in medicine, and insulin is one of them. So we know that they can do so much more than just, say, like a statin or a cholesterol or you know, blood pressure medicine. We know pharmaceuticals kind of are designed to completely alter the way that the body normally functions. Peptides are designed to mimic what the body is intended to do. So I'm going to dig into that a little bit more, because it's easy. Because I used to say a couple of years ago, I used to say, oh, these peptides are amazing. They do exactly what the body is designed to do. So there's no problem, no issues with it. But the more we're learning, the more questions that we are asking. And just to point out before going into, like, the native kind of GLP to what a synthetic, now the GLP peptides look like, I wanted to just reiterate the the importance of the gut. And the gut, the gut hormones, the GLP hormones, obviously are supposed to be signaled on a regular basis by certain nutrients. So we are supposed to be able to get that by our food. But now that is no longer happening because of all of the inflammation in the body, all of the gut issues. Like Erica said, it's the standard American diet, it's the process, the dyes, the chemicals. I mean, you name it, it's destroying our gut health. So that's why these GLPs are no longer functioning the way that they should. So if you look at the actual chemical structure of a GLP, a glucagon-like peptide in our body in a natural state, it is I think it's a 23 amino acid molecule. I'm going off of memory. It's something around there. And then you kind of can see here, so this is our native GLP. This is liraglutide. So this is one of the peptides that came out, I believe, like 5 years ago. It was slightly different. They altered the chemical structure of the native GLP to extend the half-life of the peptide. So now we have, semaglutide, which is obviously Wegovy and Ozempic, and they've been able to alter the molecule so that now the half-life is 7 days. So you go from, a half-life of natural native GLP, which is 2 minutes, to a product that, is no longer, it's not used as much, because they're reinventing these things all the time. That used to be 13 hours, and now we have a half-life of 7 days with the new products on the market. So I will kind of go back to that, but to kind of again, so help you understand that GLPs are we're supposed to be signaling, and these peptides without the use, obviously, of injecting ourselves. So food, you can do a Google search. There's many different foods that are going to increase GLPs. There's a lot of products coming out on the market nowadays. Erica mentioned the Akkermansia. There's so many now that are, they're all over YouTube. This product increases GLP, this product. So it's everywhere. And then again, it's whole natural food that is supposed to be doing this. There are specific ones that increase it more than others, but at the end of the day, it really is fiber that's going to be the main driver of GLPs. There are some fats. You can see in the image that those are actually foods that have been known to increase GLPs the most. So obviously avocado, eggs, vegetables, olive oil, and certain grains. So going back to the injection and the half-life, these are some of the questions that we're asking now, because we are seeing incredible results with our patients. I mean, there's no doubt about that, but we're always thinking outside of what is supposed to be happening that's not in a natural state. So when you inject the medication and you get a rise in the GLPs, and the GLPs are, signaling to all the receptors in the body, if it was a natural event, the GLP would drop and go to baseline after 2 minutes. But what's happening now is we're injecting, you're getting this surge of GLP production, and the receptors are being signaled and it's not going down until 7 days later. So you're getting this elevation for a prolonged period of time, but then what happens is now you're taking another injection 7 days later because it's a weekly injection. So as you can imagine, the GLPs they're not really ever coming down. So what does that mean? So then we start digging into the cellular, the cellular health, the cellular receptors. Is this mechanism, is it sustainable? And what we're seeing and what we're hearing out there now is there's a pretty significant plateau effect that is happening. And some of the reasons why you are going to start seeing patients that weight loss stops. And I'm not saying it's one reason, it's multiple reasons. But again, when you think about the peptide and what it's doing at a cellular level, you can only signal to the cells when receptors are in a state to receive the signal. So if you look at this image, you can see, let's pretend this is a cell and it's ready to receive the GLP signaling. But now, because it's constantly elevated, these receptors become saturated. So what's happening, now that the cells can no longer receive the signals because it's never going back down to baseline. So this is what we're seeing, and now we're coming up with different plans to kind of circumvent this whole issue that people are experiencing. And some things, and we just kind of highlighted some things that we're trying out right now, and they seem to be working. But I know just, as people are staying on these medications, these peptides for a longer period of time, we're going to see more and more of it. But our strategies are always that we keep people on the lowest dose possible for as long as possible. There's no reason to keep dosing up, just like the pharma protocol is. That is the luxury that we have as a weight loss business, and we work with compounding pharmacies. We are customizing doses specific to the patient. Whereas if they pick up that pen, if they get that pen delivered to their house from the pharma company, they're following the protocol and they're dosing up. And that is why people are having so many side effects, because the problem isn't the medication. Typically, the problem is the dose. It's just like if you gave too much insulin, you're gonna feel that, and something negative is going to happen. So really understanding dosing is crucial. This just came up today, and I just added it in there last minute because it was very, very interesting. We have had several reports of people that are checking. So these peptides are supposed to have a positive effect on insulin and blood sugars. That is like the main mechanism of action. So a couple people are reporting that patients have been on these peptides now for over a year, and their insulin is creeping up. So what I started to think about was, okay, why is this happening? And again, there's always multiple things, but when you think about it, I mean, we're treating insulin resistance. So if we're taking a peptide that's increasing insulin, but the insulin's not doing its job because it can't get into the cell, well, are we just causing hyperinsulinemia now because the body is not in a good metabolic healthy state to actually receive the medication? So I don't want to go down the rabbit hole with that, but again, these are just examples of things that we're thinking about. And when we see things that now we're going to try different things. We're going to look at insulin more closely with some patients because we want to see if that is happening in more patients that we're not even aware of. People need to take breaks. If you're working with patients and they're plateauing and they have side effects, they're not feeling great, they're tired, have them take a break and have them take a pretty long break. Some people will respond with just taking a week off or taking a couple weeks off. But for some people, I think in order to really regenerate and kind of get the cleaving of the receptor cells, like get those ready again, you really have to be able to, allow those GLPs to fall. to baseline. You could, for people plateauing, again, supporting supplements, we found to be very helpful. Berberine, short chain fatty acids, just getting fiber, getting enough fiber in people, that in itself goes a long way. We have tried Akkermansia on a number of people. That seemed to work well. Again, we don't focus on one thing. We use Akkermansia when we see it's really not even detectable in a test. So then we're like, all right, we know they definitely need Akkermansia. So again, there are definitely different supplements. These are things that we talk about in our platform, and we are constantly putting different protocols together to help support patients on GLPs. Some other things to think about is, semaglutide, and semaglutide is a single agonist. It's a GLP-1 single agonist. Tirzepatide is a dual, so now it has, signaling to more receptors, and now they're going to be coming out with a triple agonist. So it might be worth a conversation of, okay, semaglutide, you've been on it for over a year, going on 2 years, maybe let's try the dual agonist, because we have seen when we switch people from semaglutide to tirzepatide, they respond really, really well to that. And at the end of the day, our goal is to get people in a healthier metabolic state. And that's where all of our protocols and our programs that we put together are so helpful. So we have what we call strategic weight loss programs. They are 30-day programs that completely change someone's metabolic health in a short period of time. Also, it's weight loss as well. And then, sometimes we have to either stop the patient, work on their gut for a while, and then they can resume, or sometimes we work on their gut while they're on the GLP. So it really depends. Everyone is different. But these, again, are just some things that you can think about, because you all will, forever be working with these patients for a long time now. This is just a snapshot. And, I've done now just separate presentations about our Weight Loss RD platform, but we have different protocols. They're 30-day programs. We have the Total Gut Reset, HCA, HCG, and HC2 are what we call our strategic weight loss programs, quick weight loss while you get the body into a healthier state. And then now a big focus for us is really our GLP support program. And we are just finishing up our GLP training course that I'll be introducing to you guys shortly here as well. But the key points before we wrap up here is that the gut, you have to look at the gut, whether that be testing, whether that be symptoms. You have to find out kind of what's going on with the patient. Food, obviously, dietitians, we don't have to teach you about healthy eating and things like that. But I think sometimes we get so used to kind of succumbing to the modern world we live in, and we forget to tell people that, yeah, you need to be eating, clean food, but a lot of clean food is still very processed. So really taking it a step further, making sure they're getting enough fiber. Nobody's getting enough fiber, and that can be a game changer just in itself. Getting variety, diversity in the diet is the key to gut health success, period. So if your patients are eating the same foods over and over, they will continue to have gut issues, and they will probably create more. So making sure that people are trying different recipes, buying different vegetables, not just eating the same fruit every day, those types of things. And again, we have to become better, more sophisticated practitioners when working with these patients. We can't just keep honing in on the diet and, if we can just tweak this and we can reduce that. We really have to look at the full picture, and we have to understand these medications really to its core, because it's just going to be, there's going to be more and more coming out. Our belief is that, because it's the first question that people ask, what happens after I go off of it? And we always respond in the same way. It depends on your metabolic health. because if you lose 30 pounds and you're still incredibly metabolically unhealthy, well, then you probably, we still need to work with you and you probably should stay on it for a little longer versus some people that lose 30 pounds and they've changed everything and everything looks amazing. Visceral is down, muscle mass is strong, lean body mass is looking good, no inflammation. That type of patient doesn't need to be on it anymore. So that's kind of our stance. We're all about what is going to work best for the patient. That's it. And really along the way, getting them in that healthier state. So this is our course that we have been putting together. This is our 6-week GLP training course. We decided to start these monthly sessions because we feel like we have so much that we can support other dietitians with, but we thought it would be so much better just because of all of the questions that we've been getting about the GLPs and managing patients. So we put together a training course. It's a 6-week course. And it literally will help you in so many areas, especially not only functional weight loss, but of course, our focus here is the GLPs. We're going to provide you with all the resources that we've been using. And you can kind of see just a snapshot of the agenda, the curriculum. They're going to be weekly classes for, again, the 6 weeks, Thursdays at 12. It's going to start December 5th. And we're going to try to keep the class somewhat small, or just so we can keep it more intimate. And our regular price is $4.99. We're offering it for $3.99 right now for the first 10. And you can click on the QR code for signing up for that if you're interested. And then just to summarize our whole Way Less RD platform, if you are interested in learning more about that and what that all means, you can definitely book a call for that. But it really includes mentoring our specific protocols. We consider ourselves weight loss experts. We've created so many resources over the last 10 years. We have apps that support your patients. And again, it's really going to give us an opportunity to learn from all of you as well and seeing what's really what's going on out there, what are your experiences, and how can we all, really help each other.